Welcome back to Live Now from Fox. Thank you all so much for streaming us on this beautiful Saturday, August 7th, 2021. Switching gears and turning to the latest coronavirus news. A community-based study by Rutgers University analyzes the reason behind vaccine hesitancy among Black and Latinx populations. I would like to welcome Dr. Shawna Hudson, research professor at Rutgers University. Thank you so much for joining us for this conversation here on Live Now from Fox.
Thank you, Rain. Very happy to be here this morning.
So, in summary, communities of color are very skeptical when it comes to vaccines.
Yes, they are. So, we did this study back in February, and we interviewed 111 individuals from a number of communities here in New Jersey that are around our academic medical centers here in New Brunswick and as well in Newark, New Jersey. And, the main things that they talked about were some concerns about how quickly the vaccines were developed. They had concerns about light and long-term effects of taking the vaccine. And then as well, they were really concerned about how was it going to affect others. And they wanted to see how that was going to play out in other communities before investing themselves.
Now, this study offers so much insight into vaccine hesitancy. What I personally find interesting is that healthcare workers in vaccine hesitant communities were also interviewed. What did the medical professionals express? Because I can imagine that working with the unvaccinated really offers a different perspective. We hear a lot of stories about people growing frustrated with those who are unvaccinated. But I'm curious, what did the medical professionals who are really hands-on and having these face-to-face conversations, what did they express?
So they had similar concerns to the members in the community. So they were concerned about the effects of it. They were concerned about how quickly it was developed. And they also wanted to know more about, how would it roll out and impact in terms of vaccine mandates for jobs. What I will say, though, is that within the last few weeks, we've seen some numbers coming from CDC and up on the Kaiser Family Foundation website that are showing that there's a narrowing gap for Black and Latino communities. So we have seen in the past that the rates of uptake for the vaccine have been low, but we've seen in the last few weeks that there's actually been a steady rise in uptake of Black and Latinos who are actually going for the vaccine. So I think some of the questions that they had about waiting and seeing, I think now are starting to be answered because we're getting messages from trusted individuals in the communities who are talking about the importance and the impact of it.
So let's talk about the actual logistics. Have you run into any people in the Black or Latinx community who are actually interested in getting vaccinated, but they've just run into some challenges?
Yes, so I think, both the Black and Latino communities as well as other communities have experienced similar issues in terms of having to go to sites that required some online and as well appointments. I think now some of those logistics have been mitigated. They've been a little lessened because we're seeing sites that are popping up in communities. We're seeing more partnering with churches and other community organizations that are actually being able to provide vaccine in community locations. So, before, when the first rollout happened, there was a lot of difficulty getting to some of the sites. And I think now communities have really taken this into hand and have really started to address this issue by making appointments available that they're not appointment based. You can walk in, and as well, people can go and figure out where to get that second shot. So if you've gone one place, you're not always now required to go to the same place that you got the second shot. So those are some of the logistics that we heard about that were issues.
I see. Dr. Hudson, for our audience, I do want to read a portion of the research from Rutgers University that says Black participants mentioned distrust in the healthcare systems and government, citing experience of racism, discriminatory interventions, and medical experiments. Now, for those who may be unaware, can you speak to this very complex history in the United States healthcare system when it comes to communities of color?
Sure. So, some of what we heard from our members in the study were really a lot of discussion of things that we've heard about in the media and that people will know about in their communities. So, for example, our Black focus groups, a lot of discussion around the Tuskegee syphilis study and some of the things that happened in the past in terms of having participants in medical research that didn't understand what they were consenting to and didn't understand the ramifications. In our Latino communities, we also had some individuals who talked about the contraception and the birth control pill studies back in the 1950s that were conducted in Puerto Rico with women who didn't understand the effects of the birth control pill at that point and how that would actually impact their bodies. And so there were a number of different examples that came up in our study where people talked about the Tuskegee syphilis study, the Puerto Rico birth control pill study, and as well Henrietta Lacks and the HeLa cells that have been used to move forward advances in cancer. All of those are examples of medical experimentation that no longer happens currently. We have lots of different structures in place to make sure that we are actually conducting studies with the highest rigor and that people understand what they're getting into. But there were some real concerns that were voiced about this.
Now, as you know, the spread of the Delta variant is increasing across the country, and a lot of people, a lot of medical professionals are growing increasingly concerned. In summary, what can we do, considering the research, of course, to kind of curb vaccine skepticism, especially now that we're in another surge?
So I think, one of the major things that we've been moving towards that really will help with this is providing vaccines in communities and making sure that trusted messengers are really getting the message out about the importance of vaccines. So we heard from people in our study that they wanted to hear from not just the doctors on the news, but their own doctors. They wanted to have access to their doctors to be able to talk about vaccine, how that might impact them, and how that might impact any medical conditions that they had. So being able to roll out within communities, at churches, at community settings, in primary care, those are the places where we're going to, I think, see a major rise, because a lot of people were concerned about going to some of the pop-ups and as well going to some of the larger chains, because you just don't have that relationship with the person who's giving you the shots there. You can't ask the questions, and it's really difficult to know that you're getting the right information. So really addressing the logistics in our communities.
Absolutely. I'm sure that's why medical professionals and researchers like yourself have found that whenever we entrust community leaders and faith leaders, there's a much greater impact. Okay, Dr. Shawna Hudson with Rutgers University. Before I let you go, first off, thank you so much for joining. Is there anything else that you would like our audience to know?
Sure. So I'd actually like to just say that this study was done because we were able to work with 18 fantastic groups that were community-based organizations, as well as 4 healthcare organizations in our area. And so that, I think, is one of the really important pieces about this study. It was a study that came together because researchers and community and healthcare stakeholders all wanted to make sure that we heard the voices of people in the community and really address their needs around both testing and vaccine. So thank you so much, Rain, for the opportunity to talk today.
Thank you for joining. Looking forward to hearing from you soon.